If you're over 60 and stretching every day, you might be wasting your time. No one has ever ended up in a nursing home because they couldn't touch their toes. In this video, I'll explain why stretching hasn't been helping you in the ways you might think and what actually matters if you want to stay independent. And just to be clear, it makes total sense why so many people rely on stretching. First, it feels good and seems like you're taking care of yourself as you get older. Second, doctors and PTs often recommend it. Maybe you've been doing the same stretching routine for a long time and haven't even considered if it's worth continuing with. And when people have pain, their first thought is usually to stretch. Back pain, need to stretch my back. Neck pain, my neck is so tight and it needs to be stretched. I'll explain later why this is not actually a good mindset to have if you're injured. And finally, stretching feels safe and easy, right? You're not raising your heart rate or making yourself all sweaty, and you can do it right from your living room in your pajamas. But I'll show you a much better way to use that time. But here's the real problem. The issue after age 60 is not tightness, it's weakness. And far too many people spend far too little time trying to get stronger. Stretching will not help you get up from a couch or toilet, climb stairs, or improve your ability to do any daily activities. And when these activities become a problem, it becomes increasingly difficult to live on your own. At the same time, you're becoming a higher fall risk by the day. You will never stretch your way into getting off the toilet or avoiding a fall. Later, I'm going to show you my favorite exercise that can be done in under a minute per day and addresses both of these things. And I don't just say this. I see it every week with patients who have suffered falls. Many will tell me about their morning stretching routines and how much they walk, but very few are doing any actual strength training. That is often the reason why they fell. If you're like most women I've worked with, you have limited time to exercise. And when time is limited, priorities matter. The majority of that time should be spent strength training and not stretching. Although I'll also tell you the best way to include stretching in your exercise program. And I'm sure when I say strength training, you automatically think of going to the gym and sitting on machines or picking up dumbbells. That can sound scary, but effective strength training doesn't have to mean hours in the gym lifting weights. It needs to fit into your time and lifestyle demands, as well as be something that you can stick to for the long run. And just like stretching, it can be done right from the comfort of your own home and doesn't have to be a huge time commitment. Because the most important principle when it comes to exercise is consistency. I'm not telling you to stop stretching. I'm just telling you to make sure that you address strength training first. So you might be wondering, how can you get stronger from your own living room without weights in limited time? Here are my two go-to exercises for you to begin with. Number one is the sit to stand. All you need is a chair, and then you'll sit down and stand up from it. If it's too hard, make sure you use your hands to push off the chair. If it's too easy, cross your arms over your chest like this and shoot for sets of 30 straight. It seems simple, but it's so effective for keeping your legs stronger as you get older. Number two is a push-up. And if you can't do a push-up on the ground yet, that's not a problem at all. Get in a push-up position with your feet on the floor and your hands on the kitchen counter. Go down just a little bit. And if even that is too hard, just hold a plank position for 10 seconds and then progress the time as able. These two exercises alone will do more for your future mobility than any amount of stretching will. And if you really feel the need to continue stretching, just mix it in between sets of these exercises. Many people don't even consider that strength training through a full range of motion is actually a form of stretching. Squats, lunges, high step-ups, and push-ups all address range of motion deficits while improving strength at the same time. It's a far better use of your time than standing around static stretching. If we look at a squat or a sit to stand movement, your knees and hips are going through a large range of motion, and even more the deeper down you go. And that alone is more than enough stretching for the majority of women over age 60. So when should you stretch? Definitely when you're trying to regain range of motion to an area after an injury or a surgery. Stretching is an important part of rehab following a knee or hip replacement. And often, if you're dealing with an injury, stretching areas around the injury to specifically address mobility restrictions can be helpful. For example, many people with low back pain can benefit from improving mobility in their hips and in their upper back. Notice I didn't say bending over and touching the floor to stretch out their hamstrings. Many of you watching this are doing your best to make the most of your workout time, but if you have extra time, then stretching tight areas during a warm-up or a cool down could also be beneficial. So yes, stretching can be helpful when done appropriately, but it should never be your main activity. Remember, you don't need to spend hours in the gym or even use a gym at all, because if you're not already strength training, then a few minutes of strength training, a few days per week, can change your life and will add years to your independence. It might take a little bit more effort than stretching, but I promise you that the payoff will be worth it when it helps you get off the toilet, climb stairs, and avoid falls in the future.